You're listening to the Dr. Shoup Show, continuing the conversation day and night at dtsradio.com. Here's Dr. Randy Shoup.
You've been selected for a mission of the utmost importance.
What mission?
Save the world.
Well, welcome back to the program. I thank you very much for being here, and we certainly hope you get as much out of the program as we enjoy putting into it. And so we're going to revisit a topic that we've talked about on the program before, and that's Botox and how dentistry uses Botox in a variety of different ways. And when we talk about Botox, I want you to understand Botox is called botulinum toxin A, and it is indeed a derivative of the botulism toxin bacteria that makes people very, very sick, but it's been fine-tuned and refined. And what Botox does is that Botox are little teeny tiny molecules, and if you can imagine a nerve ending that goes right up next to and almost touches a muscle, but they never actually really touch. And when you fire off this nerve ending, out of the end of the nerve ending come little chemicals that go across, that swim across this little tiny space, and then they latch onto the muscle and they make the muscle twitch. What Botox does is it goes in the little tiny space and swims around, and the Botox molecules are a perfect fit for the little holes that are there on the side of the muscle. So the Botox molecules go in there and fill up those holes. But the muscle does nothing. So when the nerve ending fires and comes down and sends the little chemicals across, there's no place for them to go. There's no port for the little chemical boats to go into. So they never have a chance to bond or bind to the muscle, and they never stimulate the muscle. So the muscle is completely healthy. The nerve endings are completely healthy. You just have Botox gumming up the works in between. Ultimately, your body dissolves the Botox away. It goes in there and it sees the little Botox molecules and it goes, oh, a bunch of squatters in here that aren't supposed to be there. So your body chews them up. And that's why when you have Botox and you reduce down the muscle activity in your face, slowly but surely the muscle activity comes back because it's eating up the Botox. The little chemicals are swimming across and now able to bind to the muscle. The muscles contract again more and more and more, and so you have to go back and get more Botox. That's how this stuff works. And dentistry has been using it for a long time. You're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup, and we're giving you a little bit of a background primer in Botox, and then I'm going to tell you about a brand new application for Botox that is simply stunning in how amazing it is and literally life-changing for a whole bunch of people. Dentistry has been using Botox a long time. We've used it for a long time in helping people treat migraine headaches. We help people treat TMJ pain because there are things called trigger points. There are certain spots that you can literally find with the end of your finger that if you push on that spot, that muscle causes all kinds of headache things. So we put a little Botox in there, we calm that muscle down, and people have simply remarkable relief from chronic headaches, chronic TMJ pain headaches, chronic migraine headaches. We've done this for years and years and years. If somebody is a real active grinder, I mean, they've got those great big side of your jaw muscles that pop out and you can see them flex and work when they get angry. We can put Botox in there, calm those muscles down so you're not grinding your teeth to death. There's a bunch of things we've used Botox for. We've also used dermal fillers because dentists have become much more involved in facial aesthetics, and I got involved in this a long time ago because of all the cosmetic dental stuff that we do. We do veneers, we do bonding, we do bleaching, and patients said, well, I wish my lips looked nicer. And I said, well, I ought to be able to do that. So I've taken the training, and I can use material called hyaluronic acid, hyaluronic acid, things like you've heard the words Juvederm or Restylane. These are syringes full of a gel. It's like clear, about the consistency of clear hair gel in a syringe, and you can place it up underneath the tissue, sculpt it, move it around, and I will be frank with you, I do great lips. I have absolutely, I love making lips very attractive, appropriate. We don't want anybody to look like a duck, okay? I mean, I hate that. One of the biggest drawbacks, one of the biggest goofs that people make when they do their lips is they think they want just their upper lip done. It is absolutely the worst thing you could possibly do in terms of doing your lips. You absolutely, positively want to do the lower lip first. If you're augmenting your lips, do the lower lip first. Then you do the top lip to make it match so that you don't look like Donald Duck, for crying out loud.
You're listening to The Dr. Shoup Show. Exclusive insider info, audio, and video is online now at ddsradio.com.